With that, I'm going to introduce our next speaker, and that's Christine Priest. She has over 25 years experience working in the health promotion sector. She's the chair of the Ontario Healthy Schools Coalition. She's co-chair of the Accreditation Committee for Health Promotion Canada. And presently, she's also the mental health and well-being lead for the St. Clair Catholic District School Board, supporting system-wide health promotion approaches. She has worked as manager of school health at Middlesex London Health Unit. And in both roles, she's really led multiple disciplines to help practice health promotion within their various roles. So I think she's really seeing this as a distinct profession, but also how other professions can boost the goals and the application of health promotion. And she has a Master of Health Studies degree and is also an accredited Masters of Health Education Specialist. So with that, Christine, I'm going to turn it to you. Are you there, Christine? Christine, I think you're muted. I think Danielle's going to maybe unmute. Hello?
Hello?
There's a lot of feedback.
Can you hear me?
Yes, you're good now. Yes. Okay.
Okay. Did she unmute my computer or my phone?
Okay, there's quite a bit of feedback still, actually.
Okay, let me try again. Is that better?
Oh, that's perfect.
Yeah, okay. I think, yeah, I thought I was not hooked into the computer, so I apologize, everybody. First of all, I wanted to thank Irv Rootman. You know, I look at Irv, when I hear Irv's name, I think he's, to me, the guru of health promotion and has been. So thanks to Irv for his work on Health Promotion Canada, and to Lesley for their work around the survey. Back in 2005, when I obtained my master's, actually, the Ontario Healthy Schools, which had Dr. Andy Anderson working from Oickle at the time, was very interested in bringing accreditation to the health promotion field. So this has been talked about quite a bit in Canada. And that at that time, we actually did a survey as well, and there were probably, I would say, 70% that wanted health promotion accreditation or even a college of health promoters, while some really felt against it. Reason being it would become a more exclusive profession, and as we know, health promoters are inclusive, and that's really what one of our main goals is when we work in health promotion, is that we're inclusive, we're equitable, all those things that come with health promotion. So along the way, I've met many professionals along my journey of health promotion, and recently in 2017, I took it upon myself to become accredited through the National Coalition, or the Coalition of National Health Education, which is right now in the States. And that'll be the first theory that I'll talk to you about, or first format that I'll talk to you about. I'm going to present the models that we know that exist around the world, and I thank Leanne for mentioning Australia and Ireland because I'll be talking about them. But U.S. model has, they're through the National Commission of Health Education Credentialing. They are their own entity. They're not tied to the International Union for Health Promotion and Education. They enhance the professional practice of health, they call it health education, but if you look at the core competencies, it really is health promotion. It really does align with the International Union of Health Promotion and Health Promotion Canada core competencies. And they want to promote and sustain a credentialed body. They have a board of governors who govern, or board of commissioners who govern and are accountable to all their activities. The 7 competencies that they actually identified with the core competencies have been done through a job analysis. So they have 3 main areas of focus within their organization. First one is certification. So there's a periodic review and evaluation of certification and examination processes. They recommend policies and procedures for administering what is known as the Certified Health Education Specialist and the Masters of Certified Health Education Specialist exams. They participate in item writing workshops, and they ensure that the National Commission of Health Education competency testing meets acceptable standards. So they have professional development, professional preparation, and practice. So they've really done a lot of work. This system, I have talked to Linda Lipsey, who is the executive director of this organization, and this organization started their work back in the 80s. So they've really, really developed a model for health education, health promotion in their country. The second focus of their model is professional development. So this group recommends policies and procedures related to the designation of continuing education provider, recertification, and the annual renewal of certification of health education specialists, or MCHES. They recommend fees for recertification. They have an annual renewal, and they have provider designation. A provider designation is an agency, for example, I might just say Canadian Public Health Association would apply to this group, or the American Public Health Association would apply to this group for points that would go towards their credentialing requirements. So they apply, they write a proposal, and then this group would approve that they meet their standards for professional development. The last thing is they focus on professional preparation and practice. They work with colleges, universities, and accrediting agencies to improve professional preparation programs and promote best practices in health education promotion settings. And they monitor and update the certification, application, and eligibility review process. Other notables, as I mentioned, there are 2 accreditations. You can actually apply to be a certified health education specialist or become a master's certified health education specialist. There is an exam that people take when they want to become accredited. They have an annual fee. Their focus is beyond public health and into many, many areas. So while in Canada we often see health promotion in the sector of public health, we do know that it exists in work sites, it exists in hospitals, it exists in community health centers, it exists in education settings. So we know that the health promotion goes beyond the realm of public health. And that's the same in the States. Their code of ethics, they have a code of ethics and protocols to be adhered to. All these people require professional development in order to become recertified. And they're strongly encouraged. Jobs now are recognizing in the U.S. that they must have this accreditation in order to apply for the job, and their job postings are on the website. The Ireland model. So this association is directly tied with the International Union of Health Promotion for accreditation, but yet they're still their own entity, much like Health Promotion Canada is still its own entity. So they actually took this upon in January 2017, and they became linked with the International Union of Health Promotion, and their accrediting agency is known as the, Association of Health Promotion Ireland. They joined other countries, UK, Australia, and Estonia, which I understand the UK and Estonia have bolded, according to what Leanne just said, as leaders in adopting the internationally recognized accreditation system, which facilitates the registration of health promotion practitioners. So they're linked into the International Union for Health Promotion, but they actually are their own entity in promoting this. Registration lasts 3 years, and to re-register, practitioners will need will be required to complete an application form and submit it to their own assessment center. The board has been established to oversee the registration process. There's a panel of assessors that have been trained and a subgroup on Continuing Professional Development has also been formed. They have a list of registered practitioners that's updated constantly with expiry date on their website. They have professional development opportunities tied to accreditation through their national organization, and they do offer job postings on their website. The Australia model. The Australia Health Promotion Association is the overseeing body, and they are also linked to the International Union of Health Promotion and Education. They are volunteers, and they have a management committee focusing on assessment and applications. They have a sample online application that, and I think they also have a video that you can go through on how to apply. And it is a voluntary registration program, and there's the video that I mentioned. They have an analysis of findings recommended 3 levels of accreditation. So they have 3 levels of accreditation. Level 1 is Certified Health Promotion Officer. Level 2 is for non-specialized health promotion professionals. And level 3 is Health Promotion Advocate. And within those, there's different guidelines and different protocols on how to register. There's a fee for registration, and they require 75 hours of professional development over 3 years. And last but not least, I wanted to talk about possible steps if people feel this is worth moving forward. It's investigation into a lead organization, working group volunteers that might want to work and develop a business plan, then eventually apply to International Union of Health Promotion and Education, and then implementation of a plan. If you're interested, we can click on the link. I think Dianne will be putting that link in the box. You can click on the link and sign up if you're interested in moving this process forward. Thank you.